This is Jeremy with Chiropractic, and in this video we're going to be going over the bony features of the tibia. To start, looking straight down at the tibia, we have the medial and lateral tibial condyles. The medial and lateral tibial condyles of the tibia are going to articulate with the medial and lateral femoral condyles, forming a hinge or ginglymus type synovial diarthrotic joint. Furthermore, the medial and lateral tibial condyles serve as important attachment sites or places in which the medial and lateral menisci sit. The medial meniscus is always larger, just as the medial tibial condyle is always larger than the lateral. The medial meniscus is always also C-shaped and attaches to our medial collateral ligament of the knee, also known as our tibial collateral ligament of the knee, whereas the lateral meniscus is O-shaped and does not attach to the lateral collateral ligament of the knee or the fibular collateral ligament of the knee, thanks to the tendon of the popliteus muscle obstructing that connection. In between the two condyles, we see an intercondylar eminence. This is a general name for the two specific medial and lateral intercondylar tubercles. And on either side of this intercondylar eminence, anterior and posterior, we have intercondylar areas. The anterior intercondylar area being an important attachment site for the ACL or anterior cruciate ligament, and the posterior being an attachment site for the PCL or posterior cruciate ligament. Inferior to the lateral tibial condyle on the anterior aspect of the tibia, we have what's known as Gerdy's tubercle. Gerdy's tubercle is an important attachment site for our IT band, also known as our iliotibial band or iliotibial tract. And analogous to Gerdy's tubercle, but on the medial aspect of the tibia, we have pes anserinus, which serves as an important attachment site for the conjoint tendons of sartorius, gracilis, and semitendinosus muscles, commonly referred to as our Sargent muscles because the abbreviation for Sargent is SGT, sartorius, gracilis, semitendinosus. And in between pes anserinus and Gerdy's tubercle, we have the tibial tuberosity, which serves as an important attachment site for the patellar ligament, also known as the infrapatellar tendon, which is seen as a distal extension of the quadriceps tendon distal to the large sesamoid bone known as patella, or what we know and call our kneecap. On the posterior aspect of the tibia, we have the soleal line, which is one of the attachment sites for our soleus muscle, which is one of the two main prime movers of plantar flexion at the ankle. The soleus muscle is commonly grouped in the triceps surae muscle group, along with the medial and lateral heads of the gastrocnemius, in which the plantaris muscle can be grouped in the triceps surae group, but it's a little bit less consistent given it is only present in 10, or given it is absent in 10 to 20% of the population, and it is a lot less functionally relevant given its small size. On the distal aspect of the tibia, on the lateral aspect as well, we have what's known as the fibular notch, a notch for the fibula on the tibia. On the medial aspect, we have the medial malleolus, which is also known as our inner ankle. That concludes the bony landmarks of the tibia.